So today the government is pledging to back British produce and increase transparency in food labelling to help buyers make informed choices.
But with low welfare eggs flooding the UK and one Conservative MP calling for hormone-injected beef from Australia, will these promises be kept? The Environmental Secretary Steve Barclay is live in Oxford. Steve Barclay, I know you want to talk about food welfare. I want to talk about the welfare of the NHS this morning because you were Health Secretary for a significant amount of time. And I can imagine people this morning are pretty incandescent about the situation with the junior doctors' strike, and a number of them might be cross with the doctors, and a number of them might be furious with the government. Because why haven't you sorted this out?
Well, deals have been reached with staff across the NHS, over 1 million staff, a deal in terms of nurses, paramedics, cleaners, porters.
Junior doctors, Mr. Barclay. Why won't you sort the junior doctors' strike out?
A deal. Well, the negotiations, as I say, with over 1 million staff in the NHS, negotiations have been constructive also with other doctors, with the consultants, with the specialty doctors. But it is very disappointing that the junior doctors continue to demand a 35% pay rise, that they have walked away from the negotiating table. They've been offered a pay rise of 8.8%, which I suspect is more than many of your viewers themselves are receiving in terms of their pay rise. And the government has said that it's committed to further negotiation, and I know that the new Health Secretary has offered those talks.
They haven't walked away from the negotiation table. The government has said if you continue to strike, we will not negotiate with you. But why are you doing that? Why not let them go on strike but continue the negotiations? The negotiations need to reach a settlement that is mutually acceptable. Just by putting these demands on them and posturing and saying we can't have you going on strike, otherwise you're not going to sit at the table with us. It's you that's walked away from the table.
Well, Ben, that's not correct. The BMA walked away from the table. 8.8% average has already been offered. The Health Secretary was in discussions with them when they walked away from further negotiations. Deals have been reached. Negotiations have concluded with the consultants, the specialty doctors, with the agenda for change, over 1 million other NHS staff. And offers have been put on the table, an average 8.8% already, with the offer of more talks.
The point the junior doctors, Mr. Barclay, you keep talking about other health workers. I'm talking very specifically about junior doctors because they are currently on the longest strike in the NHS's history. And frankly, if anyone goes to hospital today during this strike, their life is at risk because of the lack of staff. Now, you can blame junior doctors. Junior doctors say there's many of us walking away completely from the NHS because we don't earn enough simply to pay our own rent. You call it a 35% demand. They're saying it's from £15 an hour to £21 an hour, and you would pay your plumber more than that to fix a boiler. Why don't you sit down and negotiate and make the NHS safer today for any patient going into hospital?
But Susanna, that's what I was saying. We have sat down with the junior doctors.
No, I'm asking you to sit down today with them.
Those starting on the lowest wages have been offered. Well, the new Health Secretary, as I say, has been in discussions with them. The new entrants as junior doctors have received a 10.3% pay rise for this year, and the Health Secretary was in discussion with them, as she has with the consultants, with the specialty doctors, and indeed, when I was Health Secretary, I did with the agenda for change. But the Junior Doctors Committee has chosen the busiest week in the NHS year to have this strike, just as they had a politically motivated strike timed to coincide with the Conservative Party conference. They are the ones that have worked away from the negotiating table. They haven't shifted from their demand for a 35% pay rise. And you're right, this is having real consequences to patients in hospitals as a result of the action that they are taking.
And all of those patients and all of our viewers watching this morning will have family members who are either going to suffer because of it, or they will have family members who are working in the medical profession who are suffering as well. Do you think £21 an hour is too much to pay a junior doctor?
I'm saying it's firstly, one's got to look at the pay in total. When you look at the total package, the escalation. An hour too much to pay a junior doctor who is responsible for the lives of the people up and down this country? Well, I don't accept that is the typical hourly rate, because if you look at weekend working, overtime working, you look at the premium on pension, you look at the pay escalation, you look at the different salaries that are paid to junior doctors, that is not a fair reflection. And the fact is that new entrants as junior doctors have been offered a pay rise this year of 10.3%, which I think for many of your viewers is much more than they will receive, an average of 8.8%. But the Health Secretary has said she's willing to sit down and negotiate further, but not while strikes are taking place in the busiest week, the week where it will cause most disruption to patients.
Right.
So that is what the Health Secretary set out. She will negotiate further with them. They have been offered an average of 8.8%, 10.3% for those, Ben, you're saying, at the entry level, and a commitment to further discussions. But those discussions can't take place whilst junior doctors are also taking action, which is harming patients in the way that it is in the busiest week of the year.
Why? Why can't they take place while the strike's going on?
Because, well, we've been consistent on that. We need to see the strike suspended in order that people can sit down in good faith and have those discussions. And the Health Secretary has been very clear on her commitment to have those discussions.
Isn't the most important thing finding a deal
with the junior doctors? But they haven't shifted. It is, but the point is, Ben, the junior doctors throughout all of these strikes have still not shifted from their demand for a 35% pay rise. That has been their position throughout. In all the interviews that you have done with them, they have not shifted from their demand for full pay restoration, taking a period that actually goes back to the previous Labour government in 2008, and demanding a pay rise of 35%. And we have a commitment to getting inflation down, which matters hugely to your viewers, to cost of living pressures, and a 35% pay rise, which remains the junior doctors' demand, is not affordable. But of course, alongside the important issue of the junior doctor strike, one of the things we're also looking at is other sections of the economy, such as farming, which is a crucial sector of the economy, and I hope we'll also come on to that as well.
It's a year today since Rishi Sunak made his 5 pledges to the country as to what he was going to achieve. Of those 5 pledges, only one of them has been achieved. One of the key pledges, of course, was reducing hospital waiting lists, which have soared, haven't they?
Well, when there are strikes, the waiting list goes up. When there aren't strikes, it comes down. If you look at the figures, for example, in October, when we had a month without strikes, the waiting lists
under
came
his
down.
watch,
So
and since he's made the pledge, they've gone up because his government and his ministers can't come to a conclusion with the negotiations.
Well, because we're not willing to pay 35% pay rises, which would have a significant impact on inflation, which in turn will cost your viewers significantly more in terms of cost of living pressures. But in the weeks when there aren't strikes, the waiting list comes down, and that's also because we boosted the number of community diagnostic centres, we're invested in surgical hubs, we're recruiting more staff, we're invested in new equipment, surgical robotic equipment, for example. We're investing in the estate, the biggest ever investment in the NHS estate in its history. We've got the first long-time workforce plan, first time in the 75-year history of the NHS we've had such a commitment to a long-term workforce plan. So the government is investing significant sums over the course of this Parliament, Ben. The investment in the Department of Health budget goes up by £53 billion. That's how much more we will be spending between 2019 and the last year, 2024, of this Parliament. So we're spending £53 billion more on the Department of Health, and that is going on the estates, the equipment, the new diagnostic centres, and invested in the new treatments.
Can I just ask one more time? Because anyone in hospital right now is nervous. You're not in a hospital right now, and you know, God forbid, I hope that you and your family are not affected, but there are plenty of people who are.
No, but my family use the NHS. My constituents use the NHS. I care about this. It matters to my constituents as well, Susanna.
Can you just explain in detail why there is this principle, which a lot of people find odd, that you will not sit down with the junior doctors while they are striking?
Well, the Health Secretary was sitting down with the junior doctors. It is the junior doctors that walked away from the negotiating committee.
They say they're open to negotiations.
Strikes in a way that the consultants haven't.
Okay, but can you explain why she won't sit down with the junior doctors right now? Because you have a principle of not doing it while strike action is going ahead. But while strike action is going ahead is when the NHS is in its most perilous position in its history, why won't she sit down with them now?
But the bottom... Well, we'll be consistent on that. The junior doctors walked away from the negotiating table.
The point is they have not shifted
from their demand for a 35%. Well, they've said they want to negotiate, and each time they've come into the negotiation room, they have refused to shift from their demand for full pay restoration of 35%. And in the interviews you've done, they will not have shifted.
Okay, so today you're saying that Victoria Atkins would willingly sit down in a room to restart those negotiations, today?
If the strikes are cancelled, then the Health Secretary is given a commitment to sit down as soon as any strikes are cancelled without having that sword of Damocles hanging over those negotiations.
I don't understand why you won't do it while the strikes are going on.
Well, because they were negotiating. Up to the strikes. It's the Junior Doctors BMA committee that's taken this political approach, that's been calling strikes in the busiest week of the year for patients, the hardest time for the NHS to deal with these strikes, just as they called them to time with the Conservative Party conference. So these are politically motivated strikes. We need to see a commitment to that in order that we can have these talks in good faith.
OK, we need them to carry on. You're no longer Health Secretary, so I do appreciate you answering questions on that. You are the Environment Secretary now, and I know you wanted to talk about food labelling and how we can make it a bit easier for people to understand the choices that they're making, particularly on some of the imported cheaper foods.
Well, I think the farming sector is really important to our economy, to our wider growth. My role is to back British farming, and one of the concerns farmers have raised with me is the feeling that often consumers are misled in the sense that packaging may have a photo that looks like a British farm, it may be described in a way that sounds like it's a British farm, but actually the products come from a different country, it's been produced to lower animal welfare standards, and therefore the consumer is buying something without fully appreciating the way that product has been produced, and that means that our farmers are not then competing on a level playing field, and that is a concern that they've raised. So we're having a rapid consultation to grip this issue, to ensure that we can empower consumers so that then when they go into their supermarkets, the labelling isn't tucked away on the back of a package, hidden in a way that's not easy to see, that we make it much more visible, much easier for consumers to understand what products they're buying so that they can make an informed choice, and that in turn is good news for British farming because our farmers produce food to very high animal welfare standards and amongst the best food in the world.
That brings us to the end of the time that we have with you, Mr. Barclay. Thank you very much indeed for joining us this morning. And I do urge Mr. Barclay to talk to his former department, because I think a lot of people are very nervous this morning about what's happening in our hospitals.